everybody. Happy Friday. Dr. Aimee Ostick here with Health and Healing Direct Primary Care. It is December 18th. This will be my last Friday video of 2020. The next two Fridays will be Christmas and then New Year's Day, and we're taking a break. And I am so happy that I get to end 2020 with these Friday videos on a positive note, with the arrival and distribution of this COVID-19 vaccine. My husband, Dr. Aimee Ostick, who's usually right here, he is in the ER. He's doing his last shift before he gets some time off. He received the vaccine yesterday. I will be getting mine next week. The way they are distributing these to healthcare workers right now is through healthcare system or hospital systems. I've been extremely impressed with how California has done this. It's very fast. I mean, the first week that it was available, you should see my feed on my Facebook of all of my former medical school friends, all of my former residents, co-residents, all of the mentors and attendings. I just love and adore finally getting this vaccine. They've all put their lives at risk and their families' lives at risk by being frontline healthcare workers. And it just gives me such hope and reason to feel happy again. It was not long ago, and it's easy to forget, 9 months ago, how scared we all were. We didn't know much about this disease. We didn't know how fatal it was. We didn't know how transmissible or infectious it was. We learned so much. And at the same time, scientists have absolutely come through for us in developing this technology prior to this pandemic, and subsequently using that technology. We put our money where our mouth was, and we created this incredible vaccine. I wanted to take 2 seconds to just dispel all of the rumors and conspiracy theories about this vaccine, because what I am so concerned about, and a lot of my colleagues and many of you should be also concerned about, is the vaccine hesitancy. Many polls, surveys out there, even in hospital systems, are showing up to 50% of people that are offered a vaccine will not take it. And that's terrifying. We need 70% of people to get this vaccine in order to develop herd immunity to get out of this pandemic mess. And there's, the hesitancy of just, I'm not going to do it because I don't get sick, I'm low risk. Number one, and I say this every year with the flu shot, it's not about you as an individual. You're not doing it really for you. You're doing it so that you don't unwittingly infect people around you that are higher risk, right? A child with an underlying health condition, a grandparent, somebody that you love and care for, and you have mild symptoms and you don't realize it and you unwittingly infect them. That's what this vaccine is for. We need everybody to get it that can. And the other conspiracies with microchip technology are absolutely baseless and untrue. Conspiracies about, I should say, misinformation about mRNA being able to change your cell's DNA. mRNA cannot enter a cell's nucleus. It's physics. It's impossible. Biochemistry. It can't. It doesn't. It won't. So it cannot change your DNA makeup. The other misinformation about, natural immunity being better than the vaccine immunity is also untrue. This vaccine immunity confers up to 10 times more antibodies than natural infection does, and can last a lot longer than natural infection. And then the last one that I hear every year about flu, does it give you the coronavirus? Does it give you COVID-19? Completely untrue. This is an mRNA, naked synthetic mRNA, that is then decoded in your body's own cells into proteins that stimulate an antibody response by your body's own immune system. It cannot go in there and just a priori create the novel coronavirus. It doesn't happen. It can't happen. It doesn't happen with the flu shot. It doesn't happen with this shot. It is so important to get this vaccine when it's ready. The first wave, 1A, will be healthcare workers, 1B will be essential workers, 1C, over 65 and at risk. Most people, most likely here in California, the 1C category will be available through kind of big box stores, Costco, Walgreens, Ralph's, whatever. However it is available, make sure, and I will make sure I'll be informing my patients on the best way to do that. Moderna goes out for authorization today through the FDA. When that happens, we'll have 50 million more doses of this mRNA vaccine over the weekend, and we'll be rolling this out real fast. This is a reason to hope again. This is monumental, historical time in our lives that we get to see happening in front of us. We all need to take part in order for it to be effective. I hope, and I know, and I pray that this is the beginning of the end of this pandemic. And I know it's been so hard for so many people, and I have learned so much through it about not making assumptions about people's backgrounds and what they're going through. This has put a lot of stress on my patients and people in the community. And, it's caused a lot of strife, even in families and communities, and there's no need for that. We're all in this together. Having that cohesive message and support is important to get us through the other end of this. Be strong, everybody. There are brighter years to come, brighter days in front of us, just around the corner. Please, if this vaccine is available to you, please get it and do your part in dispelling the misinformation and the conspiracy theories if they're presented to you. It's a group effort. It takes a village to raise my children. It's going to take a village to get this vaccine distributed to the right people and enough people. And we're here for you. Give us a call, 818-600-2426. It's www.healthandhealingdpc.com. Have a wonderful and safe holiday.